Okay, so hi everyone, welcome back to another session with Dental Shadowers. Today we are joined by Dr. Sarmicanic, a general dentist who will be telling us more about her daily life. Dr. Sarmicanic, the floor is yours.
Thank you. Well, thank you for the introduction, Desiree. It's great to be here. I hope that I can give some useful information and tips to all the pre-dental students. I've been there myself, so I definitely want to share whatever I can. So I actually am an Assyrian American. I moved from Iran. We are a Christian minority, so I came here right after high school, and then I attended a community college because one, I didn't know any English. That my English wasn't as good, so I needed to first start something to get into a 4-year university. And so I did a 2-year community college, and I transferred to UC Berkeley. And I actually loved chemistry, so I wanted to major in chemistry. And so I graduated from Berkeley in a chemistry degree. But it was during that time that one of my friends kind of introduced me to the field of dentistry, and I will go through more details about that. So I took 2 years off, kind of like studied a little bit more, took some more classes, and then took the DATs, and that's how I got into dental school. And that picture, I could not find any good pictures of myself. All my cell phone pictures are from way back when, and I don't even know where those cell phones are anymore. So that was the only picture I found actually online. And I don't know if you can detect, but that's me when I got into UCSF first. And the reason why I go through so much detail is because everybody's background and journey will be different, but you just have to make the best of it until you get to where you want. So here's a little bit more detail. So when I came to the US in 2004, I took the prerequisites to get into the UC system. And then I did some research at NASA Ames Research Center. Actually, it was related to chemistry as well, cyanobacteria and how their cell works, etc. So it had nothing to do for anything related to dentistry. But I do believe that's a tip that some schools actually really do like to see any type of research. So that was a plus for me. I did not know that was something that some schools look into, but some schools like UCSF, for example, they do look into, they do like students who've had research background. So that's why I thought that, I'm going to put that in there. So if there are students who are looking into specifically which schools to get into, and there are schools that are more research based, you can always have a research background, to increase also your chances of getting in. And then from 2006 to 2008, I was at Berkeley, and that's when one of my friends actually recommended dental field to me, because I was someone who, I would talk to people and I would have a, good conversation with them. I could start a conversation with people I did not know at all. And I was telling her one day, I said, I work in this lab, and all day long I'm by myself, sometimes till 12 a.m. and it's a very lonely life. And I don't know if I'm going to go into chemistry, and that's what my life is going to be like. And she's like, well, why don't you choose something that, you can have a conversation with people, you get to see them again. And she used to be working for a dentist. So she told me, why don't you go and shadow him and see if you like it? So that's how I got introduced to the dental field. I had no intentions whatsoever to get into dental school when I started. And that's when I got involved. I got involved with the Pre-Dental Society, which was really good at my college and at UC Berkeley. And I got involved with some other associations, which kind of helped guide me, as to what leadership is like, and to know what each position can present if you are in a certain position, what you can do for other people. So that was really good. And then from 2008 to 2010, those were the 2 years that I took time off. And I shadowed more dental offices, which was very helpful. And I took all the classes that I needed to take to get into dental school, because for dental school, I had no biology background at all. I was a chem major. So I took all those classes. I studied for my DATs, and actually one of the reasons why I did well in my biology, score on the DAT was because I was teaching bio and chemistry to some of the high school students. So when I took the DATs, actually my lowest score was in English comprehension, and I put that on there because I knew that was my not my forte. So I attended all these different presentations that different schools would give. Like I went to UOP or UCSF, they would give presentations to pre-dental students. And I would ask them, what is one of the ways to get into dental school? What are the key things you guys look at, or the scores, if you would. And every one of them gave me like a specific score. And I remember that UOP told me, if your English comprehension specifically is lower than this, we don't even look at your application. And I was like, oh, so I need to just make sure I score this particular, score. I don't know if it was 17 or 18 or 19, I can't remember, but it was, the number. I was like, I am going to get this so I can get in. So I got the lowest that was letting me into the schools. One of the websites that was very helpful to me was the SDN. I'm sure you guys are probably familiar with it. It gave me many, many good tips as to what to study, what classes to take, and different perspectives basically from different people. So I always put that on there because it was very helpful for me. And then I entered UCSF in 2010 and graduated in 2014. And I did 1 year AEGD residency. We had the option that year to do a residency or take the reps, which is the regional board. I took the boards, but I still wanted to do 1 year residency, and I did that at UCSF. So, the takeaway point is that it doesn't matter where you come from. Your journey will make you learn a lot of things. And so I feel like I had to go backpedal and try to learn a lot of new things until I could get into dental school. So it's okay if like we are from a different background or a different major. And here is the advice for college. So I don't have an actual exact answer for people who would say, what should I major in? I had many, many good friends, very successful in dental school, who were from an engineering or arts or music background. And they all got in and they were all very successful. Some even did like pediatrics and oral surgery specialties. So they're very smart people. I feel like it's easier to, you have less of a steep learning curve, if you would say, if you get into a bio-related major, because you would probably have less, learning of every single subject. So that would be my advice. But if you are from a different background, it does not matter because you can still get in and be very successful. I always put this because I had a very good friend in dental school. She applied to dental school for three consecutive years until she got in. And I had another really good friend who did a post-bac program for I believe that's a 2-year program until he got into dental school. So they all really made it through going maybe different routes, but they all finally got in and without any problems. So there is no one answer, because there is some kids who are extremely brilliant and very, very, very good at their courses. I had another friend who was getting, I believe her DATs was like a perfect 30. She was 18 or 19 when she got into our class. She was a very brilliant girl in all her courses. She just hated working with her hands, and she dropped out of dental school after the first year. So dental school basically want to know you would want to stay, not drop out, and that your DATs and your GPAs are decent. And if they're not, there's always other routes that you can take. So one of them is like the post-bac program, or other routes that you can take, and you can show the school that you're already trying. And so this book from Adia is also a very helpful book that I really liked, because it showed all the different dental schools. that are from different states and what they would like you to do or to get in based on your DATs, etc. So I put that on there too. One thing I wish I had done is to shadow some more specialists when I was in as a pre-dental. I only shadowed a lot of general dentists, but I wish I had done that. So it would have given me a more clear understanding of what I want to do. Because in dental school, I wasn't sure what I wanted to do. So I just went into dentistry, then general dentistry. But I wish I had done a little bit more of the specialty. So the moral of the story is don't give up. Doesn't matter what the background is. If you have perseverance, you will get in. It's not a problem. So for a typical day in the life of a general dentist, I have my own practice now. I just opened in August of 2020, right in the middle of the pandemic. And it's a very different setting than the associate job that I have, because I also have an associate job. So my own startup practice, it's a private practice that only takes PPOs. Those are like the type of insurances that you select. So I have less patients and I can have more time. So I have a morning huddle. It's very informal, but I have a morning huddle, and then I go over the treatments that I wanted to do for the patients. And if there's something specific that I need to go over with, then I address that. And then if there's follow-ups with patients, like somebody had discomfort or pain, or they needed a prescription, or they needed just to talk to me about something, I do that. I pay bills. That's one thing that you do not do as an associate. You cannot tell you how many bills I had forgotten to pay when I first started, because it was just all over the place. And so that's something, as a business owner, you will work on the business side, not just to pay bills, but like to do marketing and other things. So in my own practice, a typical day is a lot more, I would say, a lot more hectic. There's a lot more tasks to do. As an associate, I work in I've worked in many different places, but I work in a fast-paced medical office. And we see a lot of patients from previous dentists that work there, or associates that work there. So you just have to be careful when you're treating that patient, how you're going to address certain things, or the work that other people had done and maybe you disagree with, or the patient is unhappy with the previous dentist. How are you going to address that? So it's a different setting that I work with, but I love where I work in that dental office as well. And I usually get no lunches, very short breaks, but it's still a very, very good, it makes the day go by fast. I cannot complain. So in each office that you're going to work at, you're going to find some pros and cons. You just have to find what's going to work for you. And these are some of the examples that patients will present with. If you're in an office, for sure, they will tell you, "Oh, doctor, I have sensitivity on my teeth," and you would say, "Oh, where?" And "Oh, in general, just everywhere." And so you cannot tell them, "Well, I'm gonna do a root canal on every single one of your teeth." You have to give it a different approach. Okay, so what do you eat? Are you maybe eating an acidic diet that's wearing down your enamel, or do you have a very quote unquote good oral hygiene, that you're brushing too hard maybe, or your toothpaste is just whitening toothpaste and that can cause sensitivity? So you go through a lot of these different diagnoses for your patients, and some patients will be okay with it to give things time, but some might get upset or tell you, "Why can't you just give me this magic pill for me to get cured?" But in general, when your patients complain about something, like for example, when you did a crown, or they had a crown done and their tooth hurts, you just have to communicate with them what the reason could be. You crown a tooth to protect it, but many times you touch the tooth and the nerve can get irritated. So you have to communicate a lot of those things with the patient beforehand. Another example is usually patients present with dentures, And they would tell you, oh, my dentures are old, I just want to get some new ones. And they tell you, can you make me some new ones? And, initially I used to be like, oh yeah, of course I can make you some new ones. As years have passed by, I'm more careful. Some cases you better off not even take on. In some cases, you just have to tell the patient, well, hey, listen, you have been wearing these dentures for 20 plus years. They're like a really comfortable shoe. And if I give you new dentures, they're going to be like really new, tight, stiff shoes that you have to break into, and you might not even like them for a while. So you have to communicate with your patient on their expectations and what they have to expect from their outcome, their treatment outcome. I just wanted to point this picture that I have on there. This patient, particularly on the right side, presented with chipped teeth, and he only wanted to fix the chipped teeth. There were other things going on, but he wanted to fix his teeth. And I asked him what was the cause of the chip, and he didn't know. He could not remember what was the cause. It was not an accident. He didn't bump his head into anything. So they just chipped on their own. And when I looked at his bite, he bites exactly into those teeth in that certain position, almost matches the bottom teeth into the top teeth. So I told him, I said, if you want, I can fix them, no problem. And you can see I did fix them for him. But I said, if I fixed your teeth for you, I don't know how long they're going to last you, because this is how your bite is. So if you want these guys to last, you have to probably do braces to move your teeth. So not everything is just, fix and go. You have to make sure you address even the slightest thing, because some of these patients will, they have a copay, or they will pay for the work, and they want something that would last them many, many years. And you have to explain why or how this is possible or not possible. I'm just trying to look at the time to make sure that I'm not going to talk too much, so that way we get through the whole presentation. But some of the other examples are like patients wake up in the mornings and they have their jaw is hurting them. You have to address, do they have tense muscles? Not everybody is a grinder, and I learned that through taking extra CE courses. So you cannot just give a prescription to every single person to wear a night guard. Some people cannot even wear a night guard. So then what do you do? Again, people come with a crown in their hand, and they tell you, hey, my crown came off. Can you just glue it back on? And sometimes you can. Sometimes you truly can put that crown back on. But sometimes, there is decay. There's cavity underneath the tooth, or the tooth is completely broken. So what are the options? In general, if you understand what the patient's needs and wants are, your case presentation is going to be a lot easier. You will be able to relate to them in a way that they will be able to accept the treatment and, understand the logic behind it. So communicating and, relating to your patient is key. I used to think that dentistry is like an art of, you have to treat, do this perfect thing. In my opinion, it's honestly more of a game of psychology, that you have to first know what that patient wants. And if you cannot provide what they really want, you will have trouble later on. So some of the procedures that a general dentist can perform, honestly, a general dentist can perform all specialty work. It's just that they will be held liable as a specialist if you are performing, like, let's say, root canals, or doing something called a crown lengthening, or implants, or gingival grafts. All of those, I know that general dentists perform nowadays. A lot of dentists do orthodontics. And yes, of course, you can do those, but you just have to make sure that you are not, doing something that you're going to be held liable for later on. So you just have to know that no matter what you do, there's going to be some hard days, some bad days, and it's part of it. You just have to know how to manage it. And if you do have a case that's harder for you to do or to complete, you can always refer to a different dentist that or a different specialist. So what I like for a point of view of a general practice, I do like to have the care to be taken under like a multi-specialty practice. So I work with a doctor, an orthodontist, and also a periodontist. They actually help a lot in terms of bringing like a wholesome kind of treatment option for the patients. So let's say a patient presents, and then they also need to have some additional work for their gums. I have a periodontist who can place the implants or do some gum surgery for them. So that's what I like about having a multi-specialty office. So it's true that I'm a general dentist, but I pick and choose some of the procedures that I do. I don't like to do every single thing. So some of the terms that are important in a general dental office. So if you have you explain to the patient, and this will be different from place to place. Some places your typical patient is extremely knowledgeable. They will talk to you about biomimetics and organic things and things like that. But some patients won't even know what a crown is or what's the difference between a filling or a veneer. So if you know your patient, you have to still ask them, does that make sense? Do you know what a crown is, especially if they haven't had a crown before? Some patients know that as a cap. So you cannot say, I'm going to put a crown here, because they won't even ask you. But you have to be like, a crown, a cap, that's what I mean. And they will relate to you better, so they can follow your recommendation. So let's say they ask for an implant. When you say we're going to do an implant, and let's say they don't have multiple teeth on the bottom jaw, for example. When you say we're going to put implants, they're thinking they're going to get implants and the dentures and everything together. But no, you have to explain to them that an implant is just the part that goes in the bone, not the whole thing. Then let's say the patient's bite or occlusion, when you ask them to bite or occlude, those are the words we use, bite down, they sometimes bite on their front teeth, so they bite wrong. So you have to make sure, especially if you're adjusting their bite, that they're biting correctly. A lot of patients think that they have Invisalign, where they have these smile direct or bite. So you have to know what those are, because a lot of patients think that they have just these. I did Invisalign, and then their bite is all off, and you're like, who did your Invisalign? Oh, no, I got this online thing that I'm doing, and my teeth are not getting straight the way I want them anymore. So then you have to discuss the difference between what Invisalign is versus clear aligners. And then if you are doing root canals, or if you want to do a root canal on a patient, then the patient is like, are you going to pull my tooth? Sometimes they're wondering if the tooth is being pulled, and you're like, no. That is just a filling in your tooth. I'm not pulling your tooth out. So again, my point is, it doesn't matter what terms and cool things in the dental field. It's just that what your patient will understand. So if you are able to tell the patient from their point of view, from their language, then they will be more likely to follow you and also accept treatment. These are not my pictures. I got these from online, but I wanted to show you, for example, a crown for a patient. Sometimes if they haven't had a crown, you have to shave around the tooth. They are shocked, they are just in awe that what did you do to my tooth? And you have to explain, well, this is what we have to do to put a cap over it to protect the whole tooth, like a helmet, like a hat. And I remember there was a young girl that came to my office, and she actually needed a crown because she had a darker tooth because of a root canal. And I said, do you know what a crown is? And she's like, no. And I showed her, and she was, taken aback, because she did not know that I was going to shave on her tooth. So it's always good to tell your patient, that the crown you're going to do, you're going to shave around it, especially if you look in their mouth and they've never had a crown before. Don't just assume what they know, what a crown is. For a cleaning, A lot of patients think that it doesn't matter how much you scale, if you don't polish for them, you haven't done their cleaning for them. And some patients, when they bite down, as I mentioned before, they will bite in their front teeth. So you have to make sure that they're biting in the right position. And again, like an implant, you have to explain to them an implant is just part that goes in the bone. And I show pictures, a lot of pictures to my patients, so that they see what it's like, not the gruesome pictures that, you know, from surgery, but you can just show them so that they know what to expect. When you talk an implant, then you have an implant crown and abutment, so they can understand what that is. Okay, so this is my case. This is one of the cases. I unfortunately don't have a lot of pictures of my works that I wish I had done. That's one of my tips. Take as many pictures as you can from your work, because later on you're going to need it, and both to show the patients, to put on your website. And it's really good to take pictures. So I just started, I've started taking pictures of my work now. Here's one example. Patient presents, she has multiple missing teeth. She wants teeth ASAP. She prefers not to have something removable, but we discussed everything, and I gave her the option of doing a partial versus implants. She had some spaces where she could do a bridge. And you have to also address, are you concerned about your gap in between the front teeth? Is that's the diastema you have there, and all of those come into play as when you want to do the treatment planning for the patient. So when I was giving her the options, so when she heard first maybe how much the implants would cost her if she was going to do the implants, we decided to do a partial. This is a removable thing. So I don't think from the way that she smiled, that's her smile, that's how big she smiles, you cannot even tell that that's a partial. It covers the teeth. It gave her what she wanted in a short period amount of time. And, you know, she left very happy. So she probably might come back for more implants. But for now, she is wearing her dentures. And for her, this was ideal. It worked out. This is another patient. This is the second case. I had, one of the tips I want to give people is get a good quality camera. I still don't have one, but if you have a good quality camera, here's a great example as to why you want to have a camera. Both of these patients, this is the same patient. Both of these pictures are the same. It's just that the left one is the before and the right one are all the afters. And you can see a huge color difference. That's because I took these with my cell phone, and the light is different. So you can see that the cell phone pictures are going to always look a little different. So you're going to have a harder time, presenting your cases consistently. So this patient was actually very happy with the results. She came with, she had these two front teeth that were in temporaries. I don't know if you can tell, they're like a little bit more rough looking, the front two teeth. And she wanted to only have those ones fixed. Now, if you're in dental school, it's very, very hard to just fix those two teeth, because dental school make you first do their cleaning, and then if they have other cavities and this and that. And this patient, as a matter of fact, did. She was refusing to even take x-rays. And we had to tell her, okay, listen, if you really want these two teeth, you actually have to take some more x-rays on you to be able to tell you, okay, you have other cavities. At least you understand that we're telling you everything about your mouth. But, still address their concern, because most of the time they're just there. It's not ideal. They're not there to do every single thing. If you give them, most of the time, if you're able to compromise and give them what they want, they'll probably come back and get the rest of the work done. So this patient, for example, came to just do the two front teeth, and we fixed those. We gave her the two front teeth that she wanted, and she was very happy. And she now scheduled to come back and get her cleaning done. She has other cavities that she has to fix, but as time goes by, we're going to do those as well. This is another patient came she is actually in her third trimester. And this is something common you will see with pregnant patients. They are, they're more, when you get pregnant, you're more likely to have inflamed gums. And she has discomfort. She's had actually a deep cleaning in her second trimester, which is the safest time to do treatment for a pregnant person. And always get a medical clearance just to make sure. So we did do the deep cleaning, the scaling for her, but she still had that bump and it was very painful. So she had pain. So what are you gonna do? We got the medical clearance and we've decided to do laser for her. And this is one of the cases that laser works really well. So you can see that I removed the tissue from both the front and the back side. And unfortunately, she did not come back, so I can take a post-op because I told her if she's feeling well, she doesn't have to come back. And it worked out really good. She was very happy, immediate, results pretty much. The gums heal like nothing. So really, really good. So here, this is another example. If you're able to take multiple pictures of your work, then I've done these cases multiple times, but I never took pictures and I wish I had. That way I could show you all the before and afters really well. But this was one of the cases I had. This is another case. Patient only presents for whitening. That's all they want. And as you can see, the patient had some staining on the top teeth. So I talked to her about a cleaning. She's not interested. She just wants to have her whitening done. And I told her, I said, I can whiten your teeth, but I will not be able to remove the stains. Those are stains from coffee, from tea. Some people smoke, some from smoking. So you have to just tell them that's, I can take care of your needs, but this is the limit that I have. So I did the whitening for her. I use cold whitening in my office and it works really well. I'm very happy with it. Highly recommend it to anybody who's considering doing whitening. Their at-home kit actually works even better, but this was an in-office one. So when your patients present for one or two things only, you will try to, give them the treatment approach. Okay, you want to make sure they don't have major cavities, nothing crazy is going on with their gums or their bones. And if you can give them what they want, that's what I usually do. I just, give them their initial request. And many times they come back, not maybe right away, but they come back to that would be their, dental home. So they come back to you to get the rest of the work done. This is a case from actually my orthodontist. This patient is still in treatment, so I took the liberty of using her ClinCheck. This is from Invisalign. So when patients come and want Invisalign, there are some limitations. And if you're going to treat a case like this as a general dentist, you better be very careful because this is a very difficult case. Patient has like a crossbite. If you look on the upper left, and afterwards, the teeth are going to look a lot better. As you can see, the diastema is going to close. The teeth are going to go in the position that we need them to. But look at all the attachments and all the crazy IPRs you have to do on the right side till you get to that point. So if you're going to treat a case like this, you better have a very good understanding of ortho, because it's not just for you to just click next and then Invisalign is going to all of a sudden give you like a treatment plan and then you click next and then here are your trays, because it doesn't work like that. I treated in more quote unquote simple Invisalign cases and teeth do not go the way that Invisalign told you. So you have to understand what the biomechanics are in orthodontics to be able to do Invisalign. Again, I'm not telling people not to do Invisalign cases or braces as a general dentist, but I just wanted to show you like a case like this. If you have a specialist in your office, you can still take care of the patient's needs, but then you're not risking doing something a harm for them, So I like to have ortho as an option because many times You don't even have to do veneers or crowns. Your treatment can be a lot less aggressive and more conservative, and you can still address the patient's aesthetics needs and their occlusal needs, like their bite is going to get corrected without you doing, drilling on the teeth. This is my periodontist, Dr. Tarabi, who had done this case. It's actually not in my office, but it's one of the cases that is very telling. So this is recession, something that you will see a lot of in your practice as well, especially people who have had braces. They can have this kind of problem because the teeth have been moved maybe, and their bite has changed either too quickly or during the treatment it wasn't noticed. But sometimes recession is a consequence of ortho, but sometimes it's because patients brush really hard, or they have a toothbrush that's really, really medium or hard bristles, or they have a toothpaste that is really harsh, or they brush. I had a patient who would just brush. It was like smoking for her. Like every time she would get stressed out, she would go and brush her teeth. And I was like, no, you cannot do that. It's actually doing harm to your teeth. So this case, Dr. Tarabi did. This is a gingival graft, and he sometimes uses their own gums, but sometimes he's able to just push the gums down and use what we call non-autogenous gums. And there is almost immediate healing within a couple of weeks. It's amazing how this thing turns out. And you're not only protecting the root, you can also address sensitivity. So this is something that, it's something that you can always bring to your patient's treatment. If they have no cavities, great, that's wonderful. If their gums are great, wonderful. But if they have recession and they are, suffering from stuff like this, you have to address it, because as a general dentist, it's your job to address that, because the patient can actually lose that tooth if they lose a lot of gums. Some of the tests instruments that we use in dentistry are like the endo ice. That's for testing if a tooth is alive or if it responds normal to the cold. There is something that I use in my dental practice, and I again learned that after I attended these CE courses with Dr. Coy's. It's called the load test and immobilization test. It basically tests whether or not if your patient has a true TMJ problem, or are they having pain or discomfort because of like the muscles. So that's going to give you an answer. And then I just put a couple things like the articulator that we use, the one that I showed you on the picture here. It's a Panadent, and you're going to learn how to mount your cases. If you're working for a corporate, it's going to be very hard to mount any cases. But now that I'm in my own practice, I pretty much mount a lot of my cases, and you have to mount so that you can see things. And if you want to do nicer work or more beautiful work, something more predictable, you have to have mounted casts. So having an articulator to mount your casts on there is very, very, very helpful. And if you have a good medical and dental form, many times you will know what to test for. So what the problem is and which test you have to use. Some of the technology that is in general dentistry. So iTero is now a really big one, but I will tell you, iTero is only good for doing Invisalign. If you want to scan your teeth with it, it's not very accurate. So if you're just buying a scanner just to buy a scanner, you have to know what type and what's it for. I worked at Pacific Dental Services. They were also corporate for 4 years, and they are really big on CEREC. And CEREC has its own pros and cons, but I use CEREC a lot. Again, technology is great. You can use it. It's going to work really well for you, but you have to know that it's not to cut corners. It's not so you can just, I just have a scanner and I can just prep the tooth and the machine will make the crown for me. you have to still know the traditional way and why it's used and the modifications, because if you're just using technology to make your job easier, sometimes what if your technology doesn't work that day? You still have to proceed. So you're better off if you know the traditional ways and now why certain things are done with technology. But I'll tell you one thing that I really like, and those are the 3D printing of models, particularly because the Sprint Ray, it was a very good 3D printer, and it's very, very accurate. I don't have it now because it's very expensive, but it's not something that I want to buy. You can use that in your office instead of like mounting your cast. Laser is another thing I showed you guys in that case number 3. That's used for hard and soft tissue. That's also works really well. But if you don't have it, traditional cutting the gums will work too. It's just not as easy as if you had a laser. Advice for future dentists. I did not have one single thing. I just, in general, what I've learned is it doesn't matter where you are in your journey, you're always going to be learning some additional things. So, if you're in pre-dental, you're going to get into dental school, and then you're like, okay, what now? Then you have to find the job, and then, okay, what now? And then you maybe want to go and become an associate or own your own practice. And then, okay, what now? I need to take some more CE courses. So you're always going to be learning. So you're always a step below what your next vision is. So I really like this poem by Kipling. It's called If. I'm not going to read it to you guys, but it captures everything that I believe in pretty much. So I feel like I talked a whole hour and I am ready for any questions.
Awesome. Thank you so much. Let's get to our first question. Our first question asks, when it comes to taking prereqs, is it okay to just apply for a course at a different university? Then dental schools look at the cumulative GPA themselves, or does the classes all need to be from one school?
Okay, so I can answer that question. I actually took, so my chemistry was, the bachelor's degree was coming from Berkeley, UC Berkeley, but then I moved to San Jose. So there was no way I was going to commute again to Berkeley just to take classes, plus extension courses at UC are a lot more expensive. So what I did, I took many classes from community colleges. And I took one anatomy class when I was at UC Berkeley, and maybe one other bio class, I can't remember, just so I can have, because I knew by the end of the second year when I was at Berkeley, right before graduation, that I was going to apply to dental school. So I tried to have that from Berkeley, because I had heard that, yes, they might give like an A from a class from your UC might have a better look for the admissions than if you're an A from a community college course. But I just could not take all my classes. Like I took physiology, microbiology, some other classes, I can't remember, psychology, other classes that I had to take from a community college. And so I got in. So I don't think they care if your grades are from, or if your classes are from different schools, as long as hopefully you will do well in them. Yeah.
How long did you study for the DAT?
How long I was studying? So those 2 years, I pretty much, well, I should say 1 year, because you apply. So I took a whole year to study for it. And it was very helpful to have gone to the tutoring job that I had, because I had to learn everything really well so that I could explain it to someone. And that's the best way you can learn something. I don't remember anything from it, unfortunately, but when you learn something to explain to somebody else, that's the best way. So it took me a year to do all my bio, especially bio. That was my weak point, and I wanted to do well. I already knew chemistry, so I was focused more on my biology and my English. Those were my main two places.
Do you recommend practice ownership right out of residency?
So that's a really good question. I am somebody who always, so again, it would depend on your personality. If you feel ready, I did not feel ready out of dental school to even go become an associate. So I did 1 year residency. Some people feel very comfortable and they go out and they're, more maybe courageous. To tell you the truth, the sooner you start your journey, the happier you're going to be. But just so you know, you're going to have a harder time. So for example, now after 6 years of practice, now that I opened my practice, I'm not saying I've seen everything, but when a patient comes, I'm able to address complications a lot easier, or I can tell them or give them options better. So right off the bat, especially in this day and age where everything goes on the internet and everybody is Googling, and you have no privacy, and if you have one upset patient from you, I'm not saying they're gonna ruin your career, but they're gonna go and rant on there and everybody to see, and your other 100 patients who are happy with you, they're not gonna say anything. So that's the image you're gonna have. If you are okay with all that, then I would say go right ahead and start having your practice right off the bat, because you're going to be a lot more ahead. I wish I had started a little sooner, but again, I cannot tell, because if you feel comfortable, starting sooner is always, very, in the long run, you're going to be happier, but it's going to be a steeper, a harder, learning curve. So to answer your question, yes, but then no if you don't feel comfortable.
Did you ever consider any other specialties?
Yes, I actually really liked perio. I really like surgery. That's something I had thought about, but I'm older. When I got into dental school, I was 26. So I was already, some of the people who graduated were 26 when they graduated from dental school. So I already felt like, okay, I need to get started. And, I went to UCSF, which thankfully is not as expensive as some of the private schools. But when you get out, you have so much debt. I had to think about, whether or not I want to go and do specialty or not. So for now, I'm going to just do general. If I ever want to do specialty, I know some friends who owned like practices for 10 years, and then they started, they went and did their residency in perio, which is for surgery and implants, or OS. So yeah, it's possible, but right now I'm happy where I'm at.
What resources did you use to study for the DAT?
As I mentioned, I read a lot of threads on the SDN. There was this book I took, oh my God, it's been such a long time. I was trying to remember. I think I took Kaplan. Is that a thing, Kaplan? Okay. I took Kaplan, I believe, or one of the other ones. I think it was Kaplan. I took Kaplan. I took some study books from, I cannot remember the name, unfortunately, but it was very helpful. And I just read my whole biology textbook because I had to explain it to the students, as I mentioned. So like it gave me really depth of knowledge. So those are all the things that I used. Yeah.
What's the hardest thing about your profession?
Hardest thing I think is I mentioned it's a game of psychology. You have to understand the patient. You can be a great, wonderful dentist, but if you are not able to know what the patient wants, and if you're not able to communicate that, what you can give them, it doesn't matter how great of a surgeon, dentist, this and that you are, you're gonna fail. And I think the hard part is to know the psychology part of it. Okay, what does this patient want? can I treat this patient? Should I treat them with this treatment? And then sometimes I sometimes do, let's say I take out a tooth because it was periodontally involved, or it needed to come out. And then later on, I'm second guessing, did I really need to take out that tooth, or could I have maybe kept it for a little longer? Could I have done a deep cleaning maybe more? So it's the things that you go back and forth later on to with your treatment as well. So I think that the psychological aspect for me is the harder part. Yeah.
Do you enjoy working with children?
I actually do enjoy working with children, but not every day. In my medical office, I see a lot of kids. Most of the kids are wonderful. They're not gonna, they will cooperate if you're nice to them. But I don't know, my hat's off to all these pediatric dentists. I don't know how it requires a lot of energy, I feel like. And you have to be patient and talk in their language. And sometimes it's hard. It just takes a lot from you. So sometimes I do a pulpotomy, and by the end of that appointment, I'm just like, oh my gosh, how many more patients do we have? Is it time to go home yet? So I do enjoy working with them, but if it's every day, I don't think I could do it.
That's all the questions we have for today, but thank you so much.
Of course. Thank you guys. It was great. If you guys have
thank you.
questions, you guys can always message me on social media. I'm not a big social media person, but I'm more than happy to. I will get back to you guys. Just give me some time. So you can message me.
All right. Thank you so much, Dr. Sarmicanic, for taking the time to be with us here this morning and for answering all the questions we had for you. We really enjoyed having you.
Same here. Thank you. Have a good one.
All right, everyone. Her Instagram handle is there if you guys would like to give her a follow. Kathleen will go ahead and post the quiz link on the YouTube live stream chat. You can also find it in our GroupMe and on our Instagram. So thank you everyone so much for joining. Make sure you guys tune in for tomorrow's session. And yeah, we hope you guys have a great day tomorrow.